it is true. We can talk about it very casually. And on the flip side of that, every day we still deal with the brain emergencies, and again, I hope that's why brain aneurysm awareness is so important, because I feel like we would win the battle if we never had another emergency rupture, right? Out in the community. But unfortunately, the other way to find out and need brain surgery and to be able to treat it is if you have a rupture event and you have what's called the worst headache of your life. I also tell my patients, it's not a migraine, it's not a tension headache. If you have a minor thing, that's not your brain aneurysm. It literally is the worst headache of your life, brings you to your knees. Often people pass out because that pressure and the pain is so bad. And God forbid that ever happens to you, you call 911. It's better be safe than sorry. Right. And you have to get to the hospital emergently. And of the people who make it to the hospital, time matters and expertise matters. It's wonderful to be able to do this work in our community hospitals at Mainline Health, as opposed to, not everybody lives right next door to a university center. So when you get in, there are a bunch of things that we do emergently to save your life, and then to secure the aneurysm, and then to treat and protect your brain from the consequences of that over the next 2 to 3 weeks are very critical time period. And once people get over that hump and do well, honestly, I follow my patients. I've been in practice, I think 12 years, and I follow my patients for life. I'm not planning on retiring anytime soon, but our patients need checks, annual checks, and our patients need support, because once you've survived that, quite frankly, you have PTSD from that. It affects your life forever. So we're happy when patients get back to high functioning lives, but things like the support group that you have are so incredible, because they really need that guidance and support even years afterwards.
Absolutely. I mean, I think you touched on your approach to counseling and developing a relationship with your patients so well. When patients are leaving the care of the hospital or moving on to rehab, what are your words to them when they're kind of leaving your care?
My first words are congratulations. and you are so amazing, because this is hard. This is really hard, and when you go home, people are going to look at you and they don't see a big scar. They don't see that we shaved half your head. They, usually, again, it's a tiny puncture mark here that's healed up by now, but this is a big deal. So you're going to need to take it easy for at least the next 1 to 3 months. We talk about what that means. What does it mean to take it easy? I have a lot of patients who are moms, often, ruptured patients, often more women than men, in the prime of their lives. So they're professionals and they want to get right back to it. And we talk about, you are going to get right back. You're going to get back to it, but you need to let your body heal. So, and the other thing is, inevitably, if people have done really well, no issues with, infections, vasospasm, any of the things that could happen, need to get shunted from hydrocephalus. Even if you got off scot-free from that stuff, you're not going to feel back to your normal self for at least 3 months afterwards, at 90 days. So we just talk about that expectation. And you come back to see me in the office at the 4-week mark, sooner if you need it, but at the 4-week mark, where we're again rehashing this stuff, checking in. But I let people know, usually at the 4-week mark, that at 3 months, people tell me, I feel like a cloud is lifted. I finally have some of my energy back. I feel like I'm not in a fog anymore. My short-term memory is starting to come back, but it takes time.
Thank you for that. I know we've often thought about developing that timeline for the patient, of understanding what it is that they're going to go through. And again, it's different for every single case, right? But there is kind of these general guideposts of what this is like, because it is so different than so many other diseases.